Welcome back to Coursera. This is Lecture 12. We're now going to extend our conversation about the musculoskeletal anatomy of the upper limb to the next joint of the upper limb, and this is kind of the middle joint of the upper limb that everybody knows as the elbow joint. We're going to begin talking about the muscles that act at the next joint of the upper limb, and this is the region that we always refer to as being the elbow. And the elbow, basically our mid joint of the upper limb, is a site where the distal end of the humerus is articulating with two bones that are in the forearm, the radius on the thumb or the lateral side, and the ulna on the pinky or the medial side. So what actions are possible at the elbow joint? Well, as we see on the next slide, the elbow joint is a pure hinge joint that permits movement only, as we see on this particular slide here, movement only that occurs in the sagittal plane. And this movement basically allows us to flex and or extend the forearm at the elbow. But note that both the ulna and the radius are forming an articulation at the elbow. So when we flex or extend the forearm at the elbow, we need muscles that are certainly either attached to and or move the radius and the ulna simultaneously. And what we're going to see is the most powerful flexors and extensors of the forearm at the elbow have attachments to the more massive bone at the elbow, which is the ulna. And in reality, the radius is really just being pulled along for the ride. And as we'll see in a later part of this conversation, the radius performs a much more important function at a series of joints that are formed between the radius and the ulna, which we'll visit in a bit. All right, so let's look at a chart that illustrates the names of the muscles that are acting to flex and extend the forearm at the elbow. Note on this slide, you can see that we have many more muscles that act to flex the forearm at the elbow than we do extend. And largely because when we are flexing our forearm at the elbow, we are performing largely a motion against gravity. So note that probably the most powerful of the forearm flexors is an arm muscle called the brachialis. And this is really, as we will see, the only action that this muscle performs. Directly below that, we see the biceps brachii, a complicated muscle that we've already introduced because it acts not only at the elbow, as we will see, it also has its two heads crossing the shoulder joint and also acting at the glenohumeral joint there. The brachioradialis, kind of a hybrid muscle in a way, that muscle is actually found more in the extensor compartment of the forearm, but it is acting as a flexor because it crosses the flexor side of this joint. Then, other minor players are muscles that simply cross the elbow joint because they have a proximal attachment to the humerus and they cross it on their way to perform additional distal actions, are the flexor carpi radialis and the pronator teres. And lastly, and I didn't actually complete the name on here, the sole extensor of the forearm at the elbow is a three-headed muscle, triceps, called properly the triceps brachii. And again, we are simply extending our forearm at the elbow and returning it to the anatomic position. Note what is the controlling nerves of these actions. The musculocutaneous is the innervator, as we know, of all of our anterior arm muscles, and by virtue of its position, it certainly has the distribution to innervate the most powerful flexors of the forearm. Brachioradialis, by virtue of the fact that it has an attachment and an origin in the extensor part of the forearm, shares the innervation of all of our other forearm extensor compartment muscles, and this is by the radial nerve. Then, the radial nerve is also innervating all of the heads of the triceps as well. So we can kind of argue persuasively that musculocutaneous innervated muscles are controlling flexion of the forearm at the elbow in a major way, and radial nerve innervated muscles are controlling forearm extension. So let's look at the individual players. Over on the left side of this slide, we see again the biceps brachii. And we've already talked about how its two heads cross the anterior aspect of the glenohumeral or shoulder joint and act there. But now we can see that the distal portion of the biceps also is certainly in a position to cross the elbow joint and act there. But note that the major distal attachment of the biceps is to the radius. So yes, it is pulling the radius and along with it the ulna as it flexes the forearm at the elbow. But the radius, as we said, is the less massive bone at the elbow, and the more powerful muscles that act at the elbow will be those that attach to the ulna. And this brings us to the brachioradialis, the muscle indicated in the middle of this picture. Brachioradialis doesn't look as substantive as the biceps brachii, but yet by virtue of its attachment only to the ulna, it actually is a more powerful flexor of the forearm at the elbow. And note that this is the only action of the brachialis because the muscle arises from the distal portion of the shaft of the humerus and crosses only the elbow joint. Then those two muscles are certainly the major muscles that are acting to flex the forearm at the elbow, and as we said, they share their muscular innervation from branches of the musculocutaneous nerve. Then the extender of the forearm at the elbow is the triceps brachii. We've already seen this muscle earlier because its long head, like the long head of the biceps, crosses the shoulder joint, and it's the only one of the three heads of this muscle that does that, so only the long head of the triceps can act to extend the arm at the shoulder. But note that the long head blends together with a medial head and a lateral head that only arise from the humerus, and all three heads converge down to a triceps tendon that attaches on the back of the elbow posteriorly onto the olecranon process of the ulna. And certainly this puts this muscle to be in a position to be a very powerful extender of the forearm at the elbow. Now, we didn't list it on the chart on the couple slides ago, but note that there is a small additional extender of the forearm at the elbow, and this is the action of the anconeus. Some people would argue it's really a fourth head of the triceps in terms of functionality. It arises basically from the lateral epicondyle of the humerus, also attaches to the ulna, and is at best a weak extender of the forearm at the elbow. Then, if we look at a picture of the triceps from the neder atlas, we again have a better view not only of a dissected view on the right of the three heads. We can see the long head attaching to the scapula and crossing the glenohumeral joint. And what's been dissected away in the neder view is the components of the lateral head, splitting it and showing the course taken by the radial nerve and the deep brachial artery as they spiral around the shaft of the humerus and not only innervate the triceps on their way, but as we will see, this radial nerve, as we know, will innervate all of the muscles that we also will find in the extensor compartment of the forearm. And then we can see that this neurovascular bundle is actually spiraling around the humerus between the lateral and the medial heads, which we said are only acting at the elbow joint. All right, now then, let's move a little more distally and talk about the actions that are possible at two joints that are formed between the radius and the ulna. And these joints, somewhat logically, are called radioulnar joints. But since there are two of them, we refer to the one that's closer to the elbow as the proximal radioulnar joint, and the one that is obviously closer to the wrist will be the distal radioulnar joint. So what actions are possible at these joints? These joints perform an action that literally gives us the ability to turn the palm, which is shown here facing forward in the anatomic position, basically from front to back, allowing the palm now to face posteriorly, and we're seeing the dorsum of the hand here versus the palmar aspect of the hand there. So these actions that allow us to turn our palm 180 degrees backwards or posteriorly are known as pronation and supination. Note the slight misspelling in the atlas there, but we'll overlook that. So these are literally horizontal or rotatory movements that occur at these two joints formed between the radius and the ulna. But the other point that we want to make is, note that the radius is the only bone that's moving when we pronate and supinate. And the radius literally is rolling over such that it crosses the midshaft of the ulna as we pronate the forearm. And then when we return our hand to the anatomic position, the radius rotates back into the anatomic position. So certainly then the muscles that are going to act as pronators and supinators have to have strong attachments to the radius, and they do. So let's look at the list. Fundamentally, and I like symmetry, there are two pronators and two supinators. The two pronators are logically named. One is called the pronator teres, kind of like the teres major and teres minor, named teres because if we section the muscle, it would have a circular or round profile. And then the other pronator is a pronator quadratus, named because it's largely quadrate in shape, and we'll see that in a couple of slides. All of pronation, note, is controlled by the median nerve, which is going to be the dominant innervator of muscles that we find in our flexor or anterior aspect of the forearm. Supination, controlled by two muscles, a supinator, and also by the biceps brachii, which we saw a little earlier in this conversation, had a broad attachment after it crossed the elbow joint to the radius. So it pulls the radius in such a way to rotate it back into the anatomic position by supinating the forearm at the proximal radioulnar joint. Note that supination is controlled by two different nerves. The supinator is found in the posterior compartment of the forearm. It's innervated by the deep branch of the radial nerve. Biceps brachii, on the other hand, as we know, is innervated by musculocutaneous. And the brachioradialis is considered by many to be a weak supinator and or potentially a weak pronator, depending on the anatomic position at the elbow, and that's innervated by the radial nerve. But certainly the more powerful supinators are the supinator muscle and the biceps brachii. So let's look at the pair. So we see first off in the picture on the left, we see the hand and the forearm in the anatomic position. And this shows us quite nicely the oblique course taken by the pronator teres that arises from the medial epicondyle of the humerus, and since it crossed the elbow joint, we identified it earlier as being a weak flexor of the forearm at the elbow, but certainly its major action is to pull on the midshaft portion of the radius, rolling it over the ulna and causing pronation. Then more distally is the pronator quadratus, a deeply positioned muscle in the flexor aspect of the forearm, and certainly more in a position to act more prominently at the distal radioulnar joint. So then, we only show one supinator on here in actual fleshy fibers, and that's the supinator muscle per se, but we have to identify this area right here, which is the radial tuberosity. And that's the site where the tendon of the biceps brachii attaches after it crosses the anterior aspect of the elbow, flexes there, and is in a position to pull the radius back into the anatomic position by supinating it. And again, we show the view over on the right side of a fully pronated forearm with now the palm of the hand facing posteriorly, and obviously showing the radius having rolled over the ulna. Now let's refer to our digital atlas so we can see the muscles first that are acting to flex the forearm at the elbow. And we can certainly see them on this particular view. If we rotate it around to the side, we are seeing a number of muscles. And first off, more superficially, there is the biceps brachii acting as a very good flexor of the forearm at the elbow, but note that we can see it's coming down and attaching to the tuberosity of the radius. Can't quite see that here. So that's just the long head. There's the short head of the biceps, and we can see a little more prominently the location of its tendon sweeping over to attach to the radial tuberosity. Then immediately deep to it, we see the fibers of the brachialis, having a much more prominent attachment to the ulna and therefore in a better position to act as a flexor. And then lastly, we see the interesting fibers of the brachioradialis, a muscle that's actually developing in the posterior aspect of the arm and forearm, and therefore sharing the innervation by the radial nerve, but crossing anterior to the elbow joint and therefore in a very good position, as we see here, to act as a flexor. Then, if we refer back to our menu here, we can see an example of the extensor of the forearm at the elbow, and there it is. And obviously, the muscle that's performing this action is the triceps. And we can see the long head of the triceps illustrated there. There's the lateral head of the triceps illustrated there. We can't see it particularly at this point, the more deeply positioned medial head. There it is, presumably. So all three heads converge, as we know, down to the triceps tendon that attaches to the olecranon process and extends the forearm at the elbow. And interestingly enough, we also have on the digital atlas the little tiny anconeus muscle, which we said is assisting in this process. Now let's look at the muscles that are acting at the proximal and distal radioulnar joints. First, we show the two pronator muscles and the assistance gained by the brachioradialis. So there is the pronator teres, crossing not only the elbow joint, but attaching prominently to the middle of the shaft of the radius and acting as a very good pronator. A little more distally, we see the pronator quadratus performing the same actions at the distal radioulnar joint. And we see the role played by the brachioradialis assisting in pronation and also, as we will see, assisting in supination. So let's now look at the supinators, and here they are. And again, the supinators are going to be our old friend from obviously a conversation just earlier, the biceps brachii, there it is, attaching now prominently down to the radial tuberosity, which we see there at the distal end of its yellow tendon. And we also see the fibers, if I turn our friend on the back here, there's the supinator muscle, acting as a very good muscle that is rotating the radius back in the anatomic position. And again, we see the brachioradialis contributing, as we saw previously, not only in pronation, but in supination as well. And we can see the supinators playing that role in rotating the forearm back to the anatomic position.